I want to thank you for the invitation. I'll be also visiting Boston tomorrow, and also Baltimore, as well as Philadelphia. And of course, there's a lot going on right now that needs to be discussed. Revolutionary greetings from the comrades and friends in the city of Detroit. And we have been fighting the ravages of capitalism. It's a life and death struggle that's going on in the city of Detroit right now. Today, the emergency manager released his plan of adjustment, and I haven't had a chance to read it in detail because, you know, I've been at the airport most of the afternoon. But somebody called me who was a retiree when we were driving here, and they were quite upset because they were proposing to cut the pension payments by 1/3. This is the proposal that's been put forward before the federal bankruptcy court. The hearings are going to start next month. The fairness and equity hearings, which is supposed to be the final phase of the bankruptcy proceedings. And of course, there's going to be a tremendous amount of objections, both from the unions, the retirees, as well as those among the capitalist class as well, who want to get more of what they consider to be the debt that is owed by the people of Detroit to them. From what I understand from this plan of adjustment, the creditors are supposed to get far less than the pensioners, percentage-wise, but I haven't read it in detail, so I'm really not clear. But we have an emergency town hall meeting planned on March the 2nd, which is a week from Sunday, and the Moratorium Now Coalition initiated it. But there are other organizations that are involved, including another coalition that's fighting emergency management. The National Action Network, Detroit chapter, is also going to be involved in it. The Welfare Rights Organization as well. So we have put together a coalition of various organizations that are going to challenge this in federal bankruptcy court beginning next month. There's going to be a tremendous amount of objections to what's going on. So I just wanted to update you about what's going on in the city of Detroit. Also, I just wanted to mention very briefly that today is the 49th anniversary of the assassination of Malcolm X, El-Haj Malik El-Shabazz, who was killed in this city on February 21st of 1965. And in the latest issue of Workers' World newspaper, there's an article that talks about Malcolm X and his role in internationalizing the black struggle. It's very, very important in light of what's going on right now. I assert that a lot of the work that Malcolm X was doing back in the mid-1960s, early mid-1960s, in many ways is more relevant today than it was then, because now the class divisions among the forces throughout the world is becoming more and more protracted and more pronounced. Just look at the situation that's going on in Detroit. Look at what's happening in other cities around the United States. The ruling class is making it very clear that they have no intentions to do anything except to drive us further into poverty, and those that they cannot exploit to the degree in which they want to exploit, they just want us to go away and die. Essentially, that's what's going on. Anytime you make proposals where you're talking about cutting off huge portions of people's pensions, the only real income that they have during their senior years, and at the same time talking about cutting their health care programs, it's a sure recipe for permanent illness and death. And of course, what they're trying to do is force people into the Affordable Care Act programs. And we've been hearing so many horror stories about the ACA, about Obamacare, people being denied access to Medicare, Medicaid. Medicaid was expanded in Michigan through the Affordable Care Act. It was a big struggle in the state legislature because we have a very right-wing oriented state legislature and governor. But I guess they realized that this would provide more resources for the healthcare industry and the pharmaceutical industry, so they did approve it. But at the same time, the stories that I've been hearing from people who are saying that they've applied, for Medicaid under this new act, they've been denied, and then they shift them into this marketplace, and the paperwork and the bureaucracy is just so absolutely overwhelming that a lot of people don't even want to deal with it. And I understand there's deadlines that have been set in regard to people's ability to apply for these programs. So we got a major struggle ahead of us as working class people, as oppressed people here in the United States, and it's a worldwide struggle. It prefigures what's going on in Southern Europe, in many ways prefigures what is happening right here in the United States right now. So I just wanted to mention that. I want to thank everybody for inviting me out, and of course, it's always, yeah, I will, but maybe during the spring or the summer, you know? I've never seen a winter like this. It's really, you know, a winter. So thank you so much for being patient, and of course, we'll be back again. Thank you so much.